My name is Amber Lynn. I'm a family medicine physician, but then a lot of my work is also directly working with residents to instruct them and teach them about, well, how to be a doctor, essentially. I was 8 years old when I decided I wanted to be a doctor. There were some missionaries that had come to our church and had been talking about their work in, I don't even remember which country at this point, it was somewhere in Africa. And one of the things that really stood out to me, 8-year-old me, was that they kept mentioning that a lot of people suffer and die from just basic illnesses just due to lack of access to care. And so I left church, and then on the way home I told my parents, like, Mom, Dad, I'm gonna be a doctor in Africa someday. I went to Washington University in St. Louis, Missouri. I learned about family medicine actually through my obstetrics rotation and learned that, hey, there's a specialty where you could still deliver babies, but then you could actually follow that baby afterwards and watch that child grow up and then deliver their baby and then continue on with the whole family. And the idea of, you know, the cradle to the grave, like being able to just cover everything and in between was very intriguing to me. You're really that first line person for the families. You're the first one to see them cry. You're the first one to kind of give them that diagnosis. Like, you know, I have my pregnant patients and I'm unfortunately the first one that says, hey, there may be a problem with the baby. We need to look further. Or, hi, I need to talk to you about your dad. Like, something's not normal about the lab work and we need to talk about this, right? So that relationship that you build with the patient is invaluable. As a primary care physician, we're also often the first line for patients to feel open. I've done a lot of talks about depression and anxiety, and really the primary care physician tends to be the first person that the patient actually says, hey, I have a problem. And to have that confidence in a patient is really meaningful for me. And I think that's part of why I chose my specialty as well. I feel like there are like two sides of me. There's the very reasonable side and practical, and then there's the kind of more whimsical, fanciful. If I was really gonna reach, I would say I'd like, I don't know, pack up my bags and move to Korea and try to be a K-pop star, like, cause you can sing and dance all at the same time. My fiance and I probably spend most of our time eating, but we will do karaoke, and he is quite committed to karaoke. We have karaoke at our house pretty often, and it's a pretty legit setup. One of the main reasons why I chose to stay at ehhealth after residency is that the level of collegiality between the physicians, between specialist primary care, is just unmatched by anywhere else. First and foremost, it's about education to the patient. It's the patient's life, it's the patient's choice. My role as the physician is to give them as much information as I can, and then watching people like really kind of achieve their goals, you know, and you have them come in like, Doc, I'm so excited for you to see my weight today. And you're like, the small little kind of successes that you get to just see with people is really what makes the job worth it.